Admission policies came directly from the top, CEO Gary Newsom.
Mr. Newsom's thought was that an average of 16% was accomplishable at all hospitals or more, and we should seek to do that and make that happen.
Vollmer, who was also fired by HMA, became angry when the company lawyers challenged him.
I did my duty by informing HMA that what they're doing is wrong. They can't require them all to have 16% admission rates and beat up doctors and administrators and all these folks over when you're doing it to increase your revenue.
I'm going to move to strike what you just said.
We wanted to talk with Gary Newsom, Health Management Associates CEO, but instead we were given HMA Executive Vice President Alan Levine, who joined the company just 2 years ago. Levine says the allegations are coming from disgruntled employees, and if they were true, he said, it would be reflected in the admissions data. He says admission rates haven't changed in 4 years and are near or below industry averages. The allegation has to do with you taking people who shouldn't be admitted to the hospital and putting them in the hospital.
Those allegations are absolutely wrong.
HMA doesn't set quotas for hospital admissions.
No.
HMA never told emergency rooms that they needed to admit a certain percentage of people that came in.
We tell them collaboratively that our goal is to make sure the patient gets in the right setting. We don't want a patient going home that should be admitted. We don't want a patient admitted that shouldn't be admitted.
I've got some documents here from Durant, Oklahoma. We showed Levine this physician performance review from the HMA hospital in Durant, Oklahoma, which had been given to us by a doctor there. It prominently shows an admission goal of 20%. It says there on the right-hand side, goal, 20%. And it shows the lights, the reds show people who are not actually meeting their goal.
Well, first of all, I've never seen this document, so I can't. I mean, I can tell you right now, as a company, there's a lot of things on this form, Steve. We look at testing guidelines. There's a lot of quality metrics on here, Steve. We measure all of this stuff.
We have here one whole column, goal.
That's not from our company, Steve. I don't know where that came from.
It's from one of your hospitals.
Steve, we don't have any kind of goals. I don't know what the percent admissions are in that hospital. Maybe they're actually 20%. But the admissions goal at any hospital is driven only by what the normal trend is for that hospital.
We've talked to 100 people who say that there was pressure from the corporate level to admit people. Are they all lying?
Steve, we have one goal, and I'm not gonna judge anybody else. Our goal is each and every patient that comes into the hospital is a unique and special circumstance.
Hardly anyone we talked to complained about the quality of care at HMA hospitals, only the quantity of care. And we were not the first to raise the subject of inappropriate admissions with corporate executives. Paul Meyer raised the allegation several years ago. At the time, he was director of compliance with HMA, charged with inspecting and auditing its hospitals to make sure they were following state and federal laws. Meyer is a former 30-year veteran of the FBI, whose last assignment had been supervising Medicare fraud in Miami before he joined HMA. HMA has said that their admission policies are designed to improve the quality of care for the patients. Do you believe that?
Based on my experience, I can't believe it.
What do you think they're based on?
I think they're based on profit.
Meyer says he reached that conclusion in 2010 after hearing complaints from emergency room doctors, caseworkers, and hospital administrators. They said they were being pressured to fill beds with people who did not need to be admitted to the hospital. Meyer says he audited 4 hospitals in Texas, Florida, and Oklahoma, and concluded that HMA had intentionally billed Medicare and Medicaid for hundreds of thousands of dollars in inappropriate hospital stays that did not meet government standards for admission or reimbursement. Did you think it was Medicare fraud?
Yes. There was Medicare fraud. Simple as that.
Why was it Medicare fraud?
They're submitting bills to the government for the admission of patients. The patients didn't meet the appropriate prescribed criteria for admission and for the hospitals to bill Medicare for the admissions. It's a false billing, if you will.
If you'd been at the FBI and somebody came in and handed you all of this stuff, would you have pursued a criminal investigation?
Yes, no doubt about it.
Meyer said he told the same thing to corporate officials and wrote up his findings in 3 memos to top management.
I made sure that I spoke with the CEO face-to-face about this, that something is really, really wrong, and it's got to be addressed. And I had indicated if it's not addressed by you all, then I'll have to handle it getting addressed by the government.
What was the response?
I had another job change.
Meyer says HMA corporate attorneys heavily edited his reports and instructed him to destroy the original version of his memos, but he never did.
I felt it was evidence. These people are changing my write-up of what I found, softening it up, excising out things, labeling it as attorney-client privilege when it wasn't, and I felt certain they're trying to cover this up.
He was eventually fired and is now suing HMA for wrongful termination.
What are we supposed to make of these allegations that have been raised by Paul Meyer? He says this company's guilty of Medicare fraud.
Well, we'll let the proper authorities be the judge of that. Okay, we feel that we are doing the right thing for our patients. It's not Mr. Meyer's place to decide guilt or innocence. We investigate anything that's reported, and if we find a problem, we fix it.
Are you saying that Paul Meyer doesn't recognize Medicare fraud when he sees it?
I think his assertions were not accurate. I think he provided incomplete information in the course of doing his own investigations. But at the end of the day, I'm not going to question Mr. Meyer. Our goal is to get it right.
HMA says it hired an outside law firm to investigate Meyer's allegations and that there was no finding that would support an allegation of fraud, adding that any overpayments from Medicare and Medicaid were rectified. But Paul Meyer is the least of HMA's problems right now. The hospital chain is currently under investigation by the Justice Department, which has subpoenaed records pertaining to the management of its emergency rooms and its computer software program, ProMed, which HMA has stopped using. The hospital chain says it's cooperating fully with the investigation and has nothing to hide.